Dr. Ackerley, thank you so much for taking the time today to just develop this quick video that we wanted to address some frequently asked questions that we receive in your office, and we feel it might be helpful for your patient base as well as other people who are facing chronic illness.
Yes, thank you.
All right, so we had some slides that I'm going to share here. What are the most common brain symptoms that you see in mold?
Okay, so again, I'm a psychiatrist, so people may have some self-selection here, but anxiety has always been the most common symptom. It's usually recognized in retrospect because everyone has always been able to find a stressor causing their anxiety. But as people go back after they've realized mold is involved, they realize they were feeling anxiety that just they couldn't fix. Doing simple things didn't help. So anxiety, and then insomnia, which is obviously somewhat linked, but just the not falling asleep at night. And again, simple things, treatments are not helping, and it starts becoming a noticeable issue because when you don't sleep well, you're not really detoxing, and the effects of mold are going to be worse. Brain fog, you know, that's when people recognize something's going wrong because they can explain anxiety, they can explain insomnia, they can explain that they might be easily stressed, but brain fog is different. Brain fog is the experience of the brain not working as well as you're used to. It's slowed down, it's slowed processing. Sometimes people describe it as just using, you know, like using your cell phone with just one bar reception. Things are very slow going into it, and going out is what the other person is hearing is not fluent, and they're not hearing everything. So it's brain fog, and it comes to cognitive impairment, word finding. Again, people are like, I know what I'm talking about, I know what I want to say, but I just cannot remember the name of whatever the object I'm trying to describe. It's like my Rolodex isn't spitting to the correct word, is what one patient told me. Yeah. Easily stressed, again, just noticing that small things, everyday things that you were handling are more difficult, and you feel like breaking down and not being overwhelmed. Depression is a little less common, but one of the ways, you know, I've recognized depression as being more of an inflammatory cause is that, again, the usual treatments for depression tend to backfire. These are the people who get put on an antidepressant and feel suicidal right away, feel it as one of the worst experiences of their life. They won't go near it. So the depression is not responding to usual treatments, including just diet and exercise. And then there's the irritability, easily angered, what I've called mold rage a long time ago, and which many people now use this word because it's easy to see, especially in couples who are trying to deal with mold together. That rage, the irritability with each other comes out easily, and it can be frightening. Lack of libido, really common, and then poor motivation. So you have all these new symptoms going on, all of them making your daily life more difficult, and you're losing motivation, losing your willpower to just get through it. And so this is at the point where you're beginning to realize you might be sick enough to call a doctor.
And so one theme that I see you keep saying with some of these symptoms is that they're like easily stressed or easily angered. So, you know, a lot of people experience depression, a lot of people experience anxiety, but it seems like there's a certain quality that you see when it comes to people who have mold or other chronic illnesses.
Right, is mostly when I see patients, they've tried multiple reasonable things and they haven't worked. So there's that quality, and then the quality is there's a cognitive issue going along with the psychiatric, which is worrisome when you're 30. Especially it's worrisome at 65 too, but it's really worrisome at 30. And then there's that, the easily stressed, the poor resilience, these things that make it harder to want to seek treatment. So the brain takes a really big hit in mold for multiple reasons, and that's one reason NeuroQuant has been used now for about 7 years or so to look at the brains of mold patients.
Okay, and so that was the next topic that we wanted to cover because we do get a lot of questions about NeuroQuants. So what exactly are NeuroQuants?
So NeuroQuants are simply, it's an MRI of the brain, and it's done with an algorithm with computerized volumetric analysis of the multiple gray and white matter regions. So they can give a pretty good estimate of the size of these regions, and then they compare them to age and sex match controls. And that's the real big deal about a NeuroQuant, is brains have very different areas or sizes depending on sex, depending on age. But NeuroQuant has been able to get a large enough group of controls to give readings that are matched for age and sex. So we can use it to diagnose Alzheimer's. We can use it to assess patterns of traumatic brain injury. And unfortunately, Alzheimer's is a common illness. And so using a NeuroQuant, and I do a lot of them, sometimes we do make the discovery that a person is showing a particular pattern that is consistent with Alzheimer's. And oftentimes it may be someone coming to the home, part of a family, who are noticing these same brain symptoms of word finding, disfluency. They know they've been living in mold, as I get NeuroQuants, and then unfortunately we get this pattern back, which is, we call it a sea of red, but it's neurodegeneration. And it's neurodegeneration in a specific pattern. The area of the brain related to memory, the hippocampus, is very small, and the ventricles, which are the softest part of the brain, enlarge in order to fill up that space. And you can see that pattern on the NeuroQuant. You teach doctors and other people how to start to read them. And one of the easiest ways is pattern recognition, is red being more neurodegeneration, sizes of the brain smaller than they are in other people of a similar age, or blue, which is neuroinflammation. And that is a more common pattern in mold.
Experiences have you come across as a practitioner when you're treating patients that have TBIs?
So as doctors, we call it TBIs, which might not be familiar to everybody. It's traumatic brain injury. What's really not familiar to a lot of people is that the knocks on their head they've gotten throughout life may have actually caused some damage. And because I come from a generation where if you fell off and, crashed your head on the monkey bars, right, and got up and were breathing, you were okay. Nobody really even made a big deal.
Right.
So many people don't realize that their head has been hit with a forceful impact, and that impact is enough to essentially disturb the softest part of the brain, which is the ventricles. The ventricles carry fluid from your spinal cord into the brain that carries the nourishment, and then it removes waste again from the brain. It's very important. And again, when there's a blow and there's more than a 15% difference in size between these holding caverns, basically, in the brain called ventricles, it's consistent with having had a TBI. And this is something we can see very easily here on NeuroQuants. We get this on every NeuroQuant. It's useful because there are multiple consequences, perhaps, of having some knocks to the head. And one is the easiest one to understand is it's going to disturb the blood-brain barrier, create some tears. And what that means is the next time you're exposed to some toxins, you have less of a barrier. It's easier for toxins to get in, and you're going to see neuroinflammation more clearly. So that's probably one of the most common things that we'll see on someone who's had TBIs. The other pattern we see is if they've gone on for a while, and that would be something like in football, where we know there is a, illness, concussive trauma encephalopathy, which is essentially a dementia, and it occurs in football players who've had a fair amount of brain injury during playing the sport, concussions. It also occurs in other sports. Soccer is a big one because of headers. And unfortunately, the headers were used in junior high and high school, not only in male, but in female. And there they have been doing some research about dementia and development of dementia in female soccer players. So there's cognitive impairment, which may be subtle, but in later life, more obvious, is something we look for because there are things you can do, which we're going to show, to reverse some of this, to make it better. That's why it's important to know this stuff.
Right. Yeah. And I think it's important to mention different ways that people can get TBIs, like you were mentioning, football or soccer. There's so many different things that can happen in life, car accidents. And a lot of times we don't always think, you've said to me in the past, like we don't always think of something being significant in the moment, but really it is important to pay attention to these things and consider them. And it seems that NeuroQuants provide us that opportunity to take a deeper look at not only what's going on presently, but how the past may be affecting the present.
Right. And possibly to give some warnings to people that you want to take better care of your head than you may have been taught, like in my generation, which is, again, if you're breathing, you're okay. It's good for you, you know, basically some knocks of life. So that was not the best thinking.
Right. Yeah. Okay. Well, then the next topic that we wanted to cover real quick was the limbic system. You get a lot of questions about the limbic system and how it's correlated to mold. Could you talk a little bit about that?
Absolutely. The famous limbic system. This is a word many people in the mold community at this point know. Essentially, it's the emotional centers in your brain. And the major parts are going to be the amygdala, which is your fear center, the hippocampus, which is a memory center, emotional memory, and the thalamus, which is a major conductor of the orchestra, grand central. It's where all sensory input goes into the thalamus. And we also have the cingulate, which is involved too. So we can see all of these structures on a NeuroQuant. And what happens with the overactivated limbic system, what we describe that is a brain which basically sees danger everywhere. It means the amygdala is overactivated. And it's, again, the fire alarm in the brain is going off for mosquitoes or for a bit of air just drifting past it. That's not a very useful fire alarm. You want it to go off for fires. So the same thing happens in people. The amygdala is too finely calibrated to see danger. When you get that sense of danger going, it generates memories in your brain through the hippocampus of past causes, past instances in your life where things went wrong. Like when I went there to, this person's house and we ate that food, I was so sick for days. There was so much bloating. It was just terrible. And I got a horrible headache and didn't sleep. And I'm, sure they have mold. And that's the kind of memories the hippocampus is usually putting up, bad memories. People rarely get wonderful memories of how great life has been. And that leads to an increased production in the brain through the hypothalamus to the adrenals of glucocorticoids, catecholamines. And all of that is a major trigger for mast cells. Mast cells do reside in the brain, in unfortunately the amygdala, and in the thalamus and the cerebellum are some known locations. So as you're thinking these thoughts that are generating stress hormones, you are then activating either further your mast cells, which are leading to more physical consequences in the body. And we call that, in trauma theory, would be the fight, flight, or freeze. Your sympathetic nervous system is now running the show. And vagal tone, which is our rest and digest, is on hold. This is so easy to diagnose. I'll look at people's symptom lists and where are most of their symptoms? They're not sleeping, they're not resting, they are anxious, and then their stomach, the digestion is just a tragedy of errors. So you can see that in the things that you're having the most problems with, as you can self-diagnose somebody with decreased vagal tone, And there are ways to improve vagal tone. There are lots of ways, but just recognizing it's a problem is the first step. And this is one place where it's been very useful to do NeuroQuants for this long with T-bars, triage brain atrophy, to see that how many mold patients have amygdalas in the 99th percentile for their age and sex. So I would say that probably 60% of my population is going to have an amygdala with that number, thalamus, hippocampus. And mathematically, obviously, that's not possible. That's not a standard distribution. So in people with mold who would see someone like me, psychiatrist, that's what we're usually looking at, is the limbic dysregulation. And it's going to lead to a lot of immune dysfunction, oxidative stress, poor choices, and delayed healing.
I have seen time and time again in your practice how an understanding of all the different parts connecting like this with the brain and the limbic system really helps people understand their deeper tendencies in their lives, and then together you're able to come up with these approaches that really facilitate deep healing. So that kind of segues into the other point that we're hoping to cover with you. Just how do people get better, and what helps people commonly when they get stuck? I know you had a couple slides in here of case studies. Did you want to go over those, or did you?
Sure.
Okay.
I'm going to go over them briefly, but you're totally correct. And I do spend a lot of time these days talking to people about safety and generating a sense of safety, because if your brain is constantly, generating danger signals, activating, as you can now see, the rest of the limbic system, the brain, and really the rest of the body, especially the gut, you are going to have a very delayed healing. And with mold, it is so easy to find danger everywhere. There's a little patch, there's something, you smell something, you feel wrong, it must be mold. So learning to find that sense of safety, and it's in yourself in many ways, it's in your body, it's learning to relax and find the vagal tone, which can make you feel safe, where we start to see some real healing and much faster healing than trying to fight against this whole physiological response, which is being generated through the brain to keep you safe. It is to keep you safe, but there's again a matter of calibration as to what safety is. That's something many people have to do.
Right. Okay,
so,
and this was an example.
This is an example of a fairly typical mold patient with TBI. And I just point this out because you can see how many places in the limbic system. We just talked about the thalamus, the amygdala, the hippocampus. I mean, these are like 99th percentile, 90th percentile. The white matter is, the cerebral white is 99th percentile, and the cerebellar white 90th percentile. The white matter, remember, is the neurons in the brain. It's the myelin sheaths. It communicates the information the neurons are generating to different parts of the brain. So it's your wires. And when the wires are essentially inflamed or slightly waterlogged, you're going to have, short circuiting. It's not going to be efficient transmission, and we call it slowed processing or brain fog. So it's very consistent with brain fog. That's really the question everyone listening wants to know, isn't it? Can you actually recover? And it is. It's not a lot of fun to see some of the stuff I've been showing, but I do have some case studies to show you, and I have more that I certainly have in my files of people who on repetitive NeuroQuants we do show improvement.
It looks like we have one here.
Right. Here's another, I think this was 2018. Again, I would have called that more of a sea of blue. The cerebellar white's in the 96th percentile. Cerebellar white, hippocampus is 98th percentile. The thalamus, 99th percentile. Remember that thalamus, when it's that inflamed, means all sensory input, being taste, smell, hearing, light, pain, is going to be really amplified you can tell if you're probably a person with some thalamic issues is you're in a car with other people, your kids, and they turn on music and it's painful. And there's always arguments about turning that music down. That's one sensory. When you're in a room, you want the lights dimmed. Is your sensory input is amplifying what other people are seeing. And that's a very big thing to realize sometimes is what you're seeing and what other people are seeing depends very much on their equipment in their brain. And we do get very different perceptions of reality, actually, depending on what kind of amplification we have going on. She did a lot of treatments, pretty severe mold avoidance. She did a protocol based on phospholipid therapy IVs. Multiple other oral treatments, and you can see marked improvements in neuroinflammation and in atrophy. It's the big deal. And in those red matter, just 12 months is you can see the inflammation came down, the cerebellar white, the cerebral white, the hippocampus, the thalamus is down the 90th percentile. Realize that's a much greater sense of comfort in your body when you've seen that kind of a difference. And the amygdala had come down to actually into normal range, which is going to be 25 to 75th percentile. And her cortical gray, this is a big one, went from 38th percentile, which wasn't terrible, but into 76th percentile, which is probably a better place to be. That's what your cortical gray is, your thinking part of the brain. And the pallidum is a filter, part of the basal ganglia, and that's also improved. So this is a lot of improvement. I remember when I went over this with her parents, her mother just started crying profusely because she could see that there really was improvement and her daughter would get better.
Yeah, well, and especially with atrophy, right? Because there's not a lot of understanding of how to bring that material back into the brain. But, you know, there's a lot of talk about reducing inflammation, but to see increase with atrophy is really valuable.
Absolutely. And it's taking me, well, Angela, you've been doing this with me for a long time. Angela's the person who's helped me develop spreadsheets to do this and look at comparisons. And I knew certainly we could get inflammation better, but I have typical medical training everyone has is gray matter, man. I mean, yes, we have neuroplasticity. It's in the hippocampus, okay? To see the other parts of the brain, especially all the cortical gray matter, improves that much took me a while to see it because I didn't think it could happen. So we all have perceptual barriers, and that was mine. But it is for most doctors, I can tell you, is, you know, once you've lost it, we're going to work around it. You don't think about improvements. So I have a couple of others to show again where we see improvements in this cortical gray. And this was a young man with POTS EDS, SIRS. And that's a really, mast cell should be on there. That's a very typical patient from my population is having the pentad there with EDS. And you can see his first scan is showing some red and some blue, but it's actually, if you look at it a little more carefully, you know, his primary motor on the right side is only in the 12th percentile. His middle temporal, which has a lot to do with hearing, you know, his left side's on the 3rd percentile. The occipital lobes are in 21st percentile. His cortical gray is the 48th percentile. This is 2017. So we can look over, it was like 2 years later, we had gotten out of bed, so he was bedridden, out of his wheelchair, walking. He was getting occupational therapy. The POTS was being treated, and POTS is a big one in terms of blood flow to the brain. And you can say, wow, the red has disappeared. His cortical gray is now in the 95th percentile. His occipital lobes are in the 91st percentile, and he was getting occipital therapy, visual therapy. His primary motors in the 71st percentile from the 20th. That's a big deal. You really need your motor neurons, your muscle mass to be moving. The middle temporals in 77th percentile. These are big. And I think at that point, we could see what looks like a more typical mold pattern had developed. And we're again working on that and hope to have a repeat NeuroQuant at some point.
Beautiful. Well, I think it's so important for people to hear these stories of improvement, to know that, you know, no matter what health state you're in, that there's hope to have real strong recoveries.
Yes, and I'd like to point out with this one, this was not people think of mold treatment and getting treatment to get this kind of improvement as incredibly expensive. And I have many patients who do not have all the money in the world to spend on this. And a lot of this was, physical therapy, visual therapy, getting him out and walking with parents, occupational therapy. There was some mold treatment. It was, mostly sort of charcoal, clay, that sort of treatment, things that are readily available. So this was not a, change the whole world, change the whole house, remediate everything. It was a lot of services that were medically provided. So it's good to hold that in mind too.
Yeah, well, that's important why there's providers like you. You've been doing this for so long that you have such a big toolkit to offer people, and everyone is so unique. So you're able to provide the tools that are specifically relevant in each case. But tying this back to NeuroQuant, I think that's our last question for today. So we'll just wrap up with that. Probably one of the more common, did you want to cover this?
Right. This is probably one of the places where most people tune in, like after the age of 50, is wondering if they're going to end up like their parents. And if your parent has had Alzheimer's, that worry becomes even more prevalent at that point. So this was a 65 exec who was having some mild cognitive issues, and his father had Alzheimer's. So the first NeuroQuant is showing red. It's not quite a sea of red like I showed you, but the cortical gray is in 22nd percentile, temporal lobes down in the 3rd percentile. His entorhinal, which is a pre-Alzheimer's region we look at, is in the 11th percentile. So, it didn't look terrific. His cerebral right and thalamus were really pretty inflamed there. And he did have SIRS. He received over that year treatment for SIRS and Lyme, plus he was started on what we call a Bredesen protocol, which is kind of an all-out approach to treating everything: hormones, exercise, diet. And in 2021, here's this repeat NeuroQuant. I mean, these are some stunning gains here. The cortical gray is now at 61 percentile, totally normal. The entorhinal, which I just said was one of those regions we look at as when that's beginning to get small, we may be seeing Alzheimer's. Look, that's up in the 51st percentile. The swelling in the white matter has come down some, and his primary motor's improved because he's really doing high intensity aerobic, and the temporal lobes have really improved. So again, this wasn't even actually my patient, somebody that I was seeing for consults, which I do, but we put it together, did the charts and measurements, and showed this, and the persons involved were obviously, happy to see what had improved and how meaningful that improvement was in terms of the goal of avoiding Alzheimer's. The hippocampus, I think, also here had taken on like 10 points too. So it's improved overall, which was not expected by most people and was very welcome.
Right. Wow. Well, it's very inspiring to see more and more of these cases. I think, that was the last one. So I'll just stop my screen share and we'll just talk about that last question that I had that people commonly ask about: why should I get a NeuroQuant?
Oh, okay. So some of the biggest reasons are it's just a baseline. And for people over 50, Bredesen has said for a long time, it's like in the same way you get preventive screening for your colons or your breasts, you really should consider preventive screening for your brain. I think that's very valid because at the age of 50, it's pretty easy to turn some of this around. 60s harder, 70s harder. It's, the earlier you're working on it, the better of seeing where the vulnerabilities might be. Second is just, since a majority of my patients have been told they're psychiatric, seeing that they actually have brain issues, neuroinflammation in their emotional centers, it's a very different sensation than just being told this is all in your head, these feelings that you're sick, insomnia and stuff, it's just all in your head, because the implication then is a pill will fix you, and a pill does not fix this. And for most people, knowing there are physical causes, basically a poison that they're inhaling, that's contributing to this is psychologically very, very helpful, because they've been gaslit by so many other physicians who, after the fourth physician, pretty much the only recommendation many of my female patients will be hearing is, you might need to reduce your stress, take up yoga, get into therapy, or maybe there's an antidepressant or a pill that will help you. And we call that gaslighting because you haven't explained the physical causes. They've almost always missed the pots. But you presume that, having some sort of a degree gives you psychiatric training, and you're making psychiatric diagnoses that don't really exist because you haven't excluded the physical. That's really important. And it's very important for disability. If you are feeling you're not going to, sometimes it's very hard to get the body back to being able to consistently work 40 hours a week. In disability, there's a very big game that's gone on for a long time, which is if you're considered psychiatric and you sign pieces of paper when you bought your disability insurance, if you're psychiatric, you're only getting 2 years of disability, with the idea that pills, I think, are going to fix it. So the game now is to prove everybody who cries or has anxiety is psychiatric and only gets 2 years of disability, except not the full disability they deserve. For essentially chronic fatigue is usually a diagnosis that's recognized and accepted. So, and that's becoming even important now with long COVID, even where we accept, yes, it's caused changes, proving those changes to the disability companies who are having a lot of people with chronic fatigue is becoming more and more important. So this has had a long history of being able to show demonstrable changes that show organic issues. And I think those are just some of the most important. And for a lot of people, it's just very exciting to see their brain and to see improvement in something you've been told can't improve, or you've been told is psychiatric and the only recourse is extended therapy or pills is very exciting.
Yeah, absolutely. Seems like it's something that is very validating for folks and gets them set with a good game plan or a direction of where to go when they understand certain aspects of what's going on.
The validation
explained
is more often than not what the person tells me is true. When I look at their brain, I can find some of the regions, and sometimes it's not quite as simple as mold or mast cells versus Lyme versus Alzheimer's. We see things with learning disabilities, people on the spectrum. And sometimes it's just useful to show different things that, are supportive of, like, hey, we probably can do some better here with, occupational therapies, visual therapies, all the things we do for sensory processing issues, which you can see, that's pretty validating too for people. It's like, here's some different approaches you hadn't considered, but these things may be more useful overall for you.
Yeah. Beautiful. All right. Well, thank you so much for taking the time today to do this. And I think this will be a really helpful resource for patients that are coming into your practice, or pre-existing patients, or even family members that are out there that would find this information helpful. Maybe they know someone facing chronic illness. Thank you so much for your time and for doing all that you're doing to help those in need.
And thank you, Angela, for being there to support this from the beginning, to do the only research we've had with it with the U of A to show some of these centers were involved with mold, and for your interest, obviously, and like, wow, there's something here.